Good evening all. I am Dr. Rajanbabu, gastroenterologist from Kolattur. I am going to briefly discuss about GERD today. What is GERD? GERD is a lifestyle disease which is the commonest condition. I can see the patients in my clinic. More than 40% of the patients in my OPD are GERD patients. GERD, in the name itself is explaining, it is a gastroesophageal reflux disease, which is reflux of gastric content, acid and bile into esophagus is defined as GERD. When it causes morbidity to patient, so patient will come and meet the doctor. So physiological GERD is there and pathological GERD is there. Physiological GERD occurs postprandially. It's a common one. When it persists more than 2 to 3 episodes a week, so the patient turn to doctor and it becomes a lifestyle disease. And what are the causes of GERD? When patient is taking untimely food and excess food, obesity and multiple drugs, NSAIDs, these are some causes. And foods sometimes precipitate some type of foods, coffee, tea, acidic foods, smoking, cigarette smoking, chocolates, these are the things precipitate GERD. Then how to diagnose GERD? So GERD basically you can diagnose clinically. When the patient presents with some complication, we will go for investigations. The investigations, number one is endoscopy to rule out complications of GERD, and we have to do a pH manometry to assess the severity of GERD. And when we are going for surgery, prior to surgery, it is a must to do pH manometry. Then we will proceed to surgery. And what is the treatment for this? So as I already told you, lifestyle modification is the main treatment of this disease. Most of the GERD, when undergoing endoscopy, more than 50% normal endoscopy finding will be there. So the patient should follow the lifestyle modifications, taking food in time and avoiding excess food and avoiding citric acids, coffee, tea excessively, and some type of spicy foods, chilies, all these things you should avoid. If you avoid, this thing will be prevented. And the treatment part, first one is PPI. The PPI is the drug of choice nowadays. We will start treatment. We can go with one is top-down therapy, second one is step-up therapy. In top-down therapy, we will start with a high dose of PPI and reduce the dose. We can supplement with antacids. The typical symptoms of GERD are heartburn and reflux. The atypical symptoms are chest pain, excessive salivation, nausea, vomiting, and back pain, and pain like cardiac anginal pain. It's mimic like anginal chest pain. So usually typical symptoms of reflux and heartburn 90% improves with PPI therapy. And atypical symptoms, we need to add some other drugs. We have to see some other complications are there, and then we have to treat it. In endoscopy, we have to look when the patient is not improving with PPI. Why? So because to rule out complications like patient is going for Barrett's esophagitis. So 1% of the GERD patients, it's a lifestyle disease. So 1% of the patient After 3 or 4 years after that, they develop Barrett's esophagitis, and when they are going for Barrett's esophagitis, they are more prone for adenocarcinoma of lower esophagus and OG junction. This is a dreaded complication. So that we have to periodically go for endoscopy when the GRD symptoms persist for years. Thank you.